Yes, sir. Yes, sir. Yes, sir.
Just let me know when the meeting is live and I'll start.
No, sir, it is live now.
Okay.
You
So,
can start.
on to this online preliminary PG quiz for the Dermatopathology Society of India annual conference to take place in Visakhapatnam from January 3rd to 5th. So these are the prelims rounds. So we have 20 teams right now participating, which is excellent. And 4 teams from this quiz will be selected to participate in the final round to take place on January 5th, probably between 9 and 10 in the morning. Okay, so some basic rules, first of all. So we've already told the participant, but all participants have to make arrangements for a good laptop, computer, and fast and stable internet connection. If there's a break in internet connection, you will miss the questions asked during this period, as we will not be able to wait or go back for you. And you need to log in through 2 devices, smartphone and a laptop, one for answering the questions and another for Zoom. Yeah, so there you go. If you prefer doing the quiz on your smartphone, please download the Kahoot app, or you can do it on your browser. We've already gone through them, and 1 login per team allowed. We've already gone through that, and all the teams, both the members have registered for the conference. Now, how does the scoring work? If you've done Kahoot before, it's easy for you. Each question is marked out of 1,000 points, and the maximum points are scored by the fastest correct answer. Time for each question. Most questions are 20 seconds, but there's, I think, one question with 30 seconds. And once attempted, we can't go back to the previous question. And the answers will be given immediately after each question, and you'll see a leaderboard where you'll know who scores the highest. See, a question is allotted 20 seconds. The person who answers at the 5th second will score more than the person who answers at the 10th second. And there's a streak bonus. When you get 2+ answers correct in a row, answers, you earn an additional 100 points per answer, up to 500 points bonus. So even if you get 6 questions right in a row, you still get 500 points bonus in the next round. And if you get a question wrong, the streak resets itself to 0, and you stop earning bonus points until you get a streak again. Wrong answer or not attempting gets you 0 points. There's no negative marking. However, fast the response time. And yes, if you do not know the answer at all and have to guess, please guess fast. Okay. So, so this is the first question. Let me go on to Kahoot later, but here, listen to the question first. This is a 60-year-old male who presented with a mildly pruritic papular rash on his back for a few years. A biopsy was taken and the following picture was obtained. I'll show you the histological picture. And now you have to identify the cause. That's the question. You'll be given 4 options. All are multiple choice questions only. So this is the histology you're looking at. Okay. I'll give you 2 seconds to a few seconds to analyze the histological picture. Okay. Now, your options are the cause. Is it a mutation ATP2A2 gene? Antibodies against desmoglein 3.
I'm not able to see options, sir, on Kahoot.
Now, wait a second. We haven't opened Kahoot yet. Don't worry. Okay. Antibodies against desmoglein 3, mutation ATP2C1 gene, and none of the above. These are your options. And let's now go to Kahoot, and we'll start the quiz, and that's when you see your options. Okay. So here you go. 60-year-old male present with a pruritic rash in the back. Identify the cause. Fastest fingers first. Got 20 answers. I'll move on basically. Right. So we've got a wide range of answers. There are only 2 people who got the correct answer, which is actually none of the above. And why is it none of the above? Anybody wants to, whoever has written none of the above, what's the diagnosis? Grover's disease. Excellent. So Grover's disease basically is an acquired condition, not related to mutations in any genes. And that's why it's none of the above. So let's see who's got the correct answers. So 2 teams, that's AIMS Delhi and RMC Canada. So yes, so this is Grover's disease. Basically, it is acquired, not genetically immune mediated. The histological deities indeed include Darius, Haley, and Pemphigus. And that's what the histology of all the diseases can look like. It looks similar, but the history here, I told you it's an L. The back, pruritic rash, just for a few years. That's a typical history of growers. So clinical pathological correlation is extremely important. And that's how you make a diagnosis of growers. It's not just histology, you need the clinical history as well. Okay, so here is the next question. Michaelis-Guttman bodies are seen in. So that's a Michaelis-Guttman body that there is seen in. And you've got 4 options. You either know this or you don't. And I don't want you Googling. So I'm going to the options on Kahoot. Is it Malakoplakia? Is it amoebiasis? Is it rhinoscleroma? Or is it leishmaniasis? Got 19 answers. That is pretty quick. Excellent. All of you have got it right. The answer is indeed Malakoplakia. Well done. So I think we need no explanation, but whoever has answered first gets more points. So let's see what the leaderboard is like. So AIMS Delhi is on top, followed by RMC Kakinada, of course, because they've got the right answer. Then JIPMA Grand, Team AMC. So whoever has answered quickest will be on top, okay? But there's still lots of questions to go, so don't worry. So yes, so Malakoplakia typically presents as white plaques or papules. In our practice, it's usually in the oral cavity, tongue, otherwise can be seen in GI tract and urinary bladder, usually immunosuppressed patients, characterized by presence of foamy histiocytes called von Hansmann cells with basophilic inclusions, which are called Michaelis-Guttman bodies due to partially ingested gram-negative bacteria and their calcification. Now, so that's what they do. Okay, excellent. So let's go on to the next question. Brother, present with multiple tumors. I'll show you a higher part of this. Testing for mutation in which gene should be recommended for this patient, okay? So this is the histology. Look at it. And this is the higher part of the same thing. A patient and his brother have multiple tumors. Which gene should be tested for? And your options are PTCH1, MLH1, and MSH2, CYLD, or APC. And your Kahoot options start now. One more team to answer. I think the 19 teams. But all the answers, but I'll wait for the seconds to finish so there's no complication. Yep, that'll be right. So most of you have got the answer right. 4 teams have got the wrong answer. So basically, the histology is showing a typical jigsaw pattern of what is a cylindroma. And the gene for that is CYLD. Patch 1 basically is, who's going to tell me what gene is for? Anybody in the... Sorry?
BCC.
BCC. What's the syndrome involved? What's the syndrome associated with patch 1 gene?
Basic syndrome.
Gorlin syndrome.
Yes, Gorlin syndrome. Well done. And MLH1 and MSH2, what is the syndrome?
Muir.
And normally, what type of tumors do you see there?
Sebaceous adenoma.
Sebaceous tumors, yes. And APC? Any particular skin manifestations of it? What may you see? Anybody, any idea? All of you have not ticked it, which is good, but there are some manifestations of Adenomatous polyposis coli in the skin. You can see basically
Epidermolytic cyst.
There are lipomas, etc. Excellent. So let's see what the leaderboard is like. AIMS New Delhi is still on top. Now AFMC has gone to the 2nd position. Sai Sudha Kakinada 3rd. Team JIPMA 4th. AIMS Bhubaneswar is on 5th position. Up 7 places. NRI Chinakakani highest climber, which is excellent. So you still have a few lots of questions to go. So don't despair. So the answer is basically Brooke-Spiegler syndrome is where you see multiple cylindromas. You can also see spironomas, and it's an autosomal dominant inheritance. Excellent. Right. So question number 4. This pattern of inflammation is not usually seen in. Okay. So that's the first question. First image, you've got 5 images. That's 1. Oops. Okay. That's 2. You're looking at the pattern of inflammation. Look at the epidermis. Look at the dermis. I'm going to go higher power into the dermis in a second. So that's the epidermis still. Then this is part of the papillary dermis. Okay. And this is probably where you make your diagnosis or make your differential diagnosis. Okay. And which is slightly deeper. So I'll just go back. So you've got 1 image there, inflammation going down to the mid-dermis. Then you have this, and this. Okay. So the question is, which pattern, this pattern of inflammation is not usually seen in? And your options are tuberculosis verrucosa cutis, TT or BT Hansen's, deep mycosis, or lupus erythematosus. Okay. So we'll go on to Kahoot. This pattern of inflammation is not usually seen in. Yeah, I think all of you have given your answers, but we'll wait for the 8 seconds to finish. You know the answer, obviously. Most of you know the answer. So you got 4 wrong answers. The wrong answer is indeed lupus erythematosus, because this is typically called pseudoepitheliomatous hyperplasia with a lichenoid and granulomatous pattern. Okay. So you don't see either of them. Well, you don't see pseudoepitheliomatous hyperplasia in TT Hansen's either, but you see a lichenoid and granulomatous pattern. So I can understand if you thought TT Hansen's is also not should also not show this pattern. But then out of all these differentials, lupus erythematosus is indeed the odd man out. Even otherwise, one is infective and the other is not infective. So easy to, pick it out. So let's see what the leaderboard is like. AIIMS Delhi still on top, AIIMS Jipma, followed by AIIMS Bhubaneswar, SMC Vijayawada, and AIIMS Rishikesh. 11 players just hit an answer streak of 3. Excellent. Right. Going on to question number, well, there you go, just lichenoid granulomatous. There is a I forgot to keep, but yeah, these are all the entities can actually present with a lichenoid and granulomatous pattern. Okay, question 5.
Sir, before you go into the next question, Jipmer Grant, please change the camera. I'm unable to see you, Dr. Shah. Camera angle, you change a bit. Yeah, thank you. Little more up. Little more up.
Okay, shall we go ahead?
Yeah, thank you.
Okay, what is the most common organism associated with this entity? That's the question. What is the most common organism? And that's your histology. Okay, so it's a low power diagnosis. You should have got your diagnosis by now. And so the question is, what is the most common organism associated with this entity? And here are your options. Is it Staph aureus, Micrococcus, Klebsiella, or Actinomycetes? And the Kahoot starts now. What is the most common organism associated with this entity? Wow. Okay. We've got very quick answers. Most of you have chosen Actinomycetes, but in fact, the correct answer is Staph aureus. People who've written Staph aureus, any idea? Can you tell me why it's Staph aureus? What's the diagnosis here?
Botryomycosis.
Yes, it's Botryomycosis. It's not a mother of foot. It's not it's not Actinomycetes. So that's why I put that in differential, because this is actually a bunch of grapes appearance typical of Botryomycosis. So it's a confusing question. I can understand why you got confused, most of you. So let's see what the leaderboard is like. AIIMS Delhi has gone down. AIIMS Bhubaneswar is now leading, followed by AIIMS Rishikesh. Jipma, AIIMS Delhi, and now NII Chinakakani is in the 5th position. Well done, all of you. You're doing good. Let's see how you fare in the next questions. So yes, this is Botryomycosis, characteristic granules surrounded by separation. You see the splendor Hopely phenomenon, which I showed you on the right-hand side in that particular thing. On the right-hand side, that's a splendor Hopely phenomenon. But this is a typical bunch of grapes appearance on the left-hand side. Okay. So Staph aureus is the most common organism, followed by Pseudomonas, E. coli, Proteus, Micrococcus, etc. Okay. So question number 6 is a slightly tricky question, but all of them are. It's a 34-year-old female, this one, with a 1.5-year history of a slowly progressive indurated plaque on the left cheek. It's occasionally itchy. She's been complaining of intermittent pyrexia too. What's the most likely diagnosis? Here we want the diagnosis, okay? So the clinical is very important in this case, and that's why the picture is here. So that's the histology, showing on the right side the silhouette image, and the left-hand side showing you close-up of what's there in the dermis. You can see part of the epidermis there. And here's a closer look at the epidermis. Okay. Something happening here, something happening here. And closer look at the epidermis. Something may or may not be happening here. Something may or may not be happening here. Okay, I think you should have made a reasonable differential or list of differentials right now. So here's your options. Most likely diagnosis: Lichen planopilaris, DLE, Jessner's lymphocytic infiltrate, or Lichen planus pigmentosus. Okay, so clinical is very important. So let's go to Kahoot. What is the most likely diagnosis? One person is not 20 people in the group, but only 19 are answering all the time. Last time was the first time the 20th person answered. Okay, the right answer is indeed DLE, and that's why I've been stressing clinical is most important. 6 of you have got it wrong. Basically, the histological picture shows lichenoid infiltrate with some pigment incontinence, but then it's a perifollicular infiltrate. Now, when you're seeing perifollicular, you may think lichen planopilaris, but the clinical is not that of lichen planopilaris. The clinical is not that of Jessner's. If at all, the clinical can be confused with lichen planus pigmentosus, but lichen planus pigmentosus does not cause such dense perifollicular granulomas in the deep dermis. Okay, your answer there clearly. Somebody wants to speak, or have you switched on a camera, phone by mistake?
Sir, actually, while answering the question for this question, we are not getting that Kahoot, sir. We answered, but it is not showing.
I didn't get you. Have you logged out of Kahoot?
No, sir.
I have no idea.
While they are showing options, that display didn't come, sir. It was easy going on like that only. After that seconds, it didn't display, sir.
I think because your internet connection is unstable. There's no other reason for it. So were you able to answer or not?
No, sir. We didn't click the answer itself.
Yeah, unfortunately, that's because your maybe internet connection is unstable. So we'll move on. Maybe you'll be able to pick up in the next questions. So don't worry. Okay. So let's see what the leaderboard is like. So we have AIIMS Bhubaneswar followed by JIPMA Team 3, AIIMS Rishikesh, AIIMS Delhi 1, and NRI Chinnakakani. So the leaderboard is pretty much the same since the last time, just one position difference. Okay. So moving on to question number, right. Okay. So you've got the answer. Question number 7. Miniaturization of hairs is commonly described in all of the following conditions except, and your options are alopecia areata, syphilitic alopecia, chronic telogen effluvium, or SLE-associated alopecia. We know about androgenic alopecia, but we're looking at other conditions. So it's only one wrong answer out of these. It's miniaturization of hairs is seen in all the conditions except, okay? So let's go on to Kahoot. Which condition is miniaturization of hair seen in all, is not seen? Basically, one condition out of these, the miniaturization of hairs is not seen. Okay, 7 of you have got it right. So this question probably will decide between a lot of teams. So alopecia areata, syphilitic alopecia, and SLE-associated alopecia can have all have overlapping features, which is miniaturization of hairs and also massive catagen. So this is seen in all these entities, in fact. Apart from chronic telogen effluvium, because if miniaturization is present, you then go on to androgenic alopecia. Normally in chronic telogen effluvium, you do a biopsy because you're not able to differentiate between that alopecia areata, chronic alopecia areata, and maybe androgenic alopecia. So if you're seeing miniaturization of hairs, you won't call it chronic telogen effluvium, okay? So that's the correct answer. So it should not be present. Miniaturization of hairs should not be present. Of course, in long-standing chronic telogen effluvium, after some years, androgenic alopecia may develop as a coexisting factor, but it's not a primary finding in chronic telogen effluvium. Okay, let's see what the leaderboard is like. So we have JIPMA team 3 now leading, followed by AIMS Rishikesh, AIMS Bhubaneswar, AIMS Delhi 1, and AIMS Delhi 2. Come on, rest of the teams, you need to pick up. So question number 8. 56-year-old female with a sclerotic plaque on the cheek. So that's your histology. You've got 2 more, I think. And then we'll see what the question is. This is just a clinical. This is one more histological picture. Notice the epidermis, notice the interface, notice the dermis, notice what's in the dermis and what's not there. Close up of the epidermis and papillary dermis. Okay, what is not the diagnosis? Your options are lichen planus, lupus vulgaris, lichenoid keratosis, or DLE. So a few of these, 3 of these entities share a similar histological picture. So your question is, which may not share the similar histological picture out of these? Okay. So your options are lichen planus, lichenoid keratosis, lupus vulgaris, or DLE. The 20th team, whoever you've just joined for fun, have you? You're not answering. Okay, so again, 13, I think, are good teams. You've been answering consistently. And out of 13, 7 seem to be very good. So either sees 13 or 7 answering giving the right answer. So indeed, what you're seeing is basically the lichenoid infiltrate with nice colloid bodies. And this is typically seen in lupus, in discoid lupus or lichenoid keratosis or lichen planus. Lupus vulgaris is a lichenoid and granulomatous I showed you earlier. That's one of the differentials. Here it's not granulomatous, it's typically just a lichenoid infiltrate. So the answer is indeed lupus vulgaris. So let's see what the leaderboard is like. So a few ups and downs, but the top 5 still remain the same. AIMS Delhi 2 is back with a answer streak of 3, which is excellent. JIPMA is leading. There's about nearly 900 points difference between JIPMA and AIMS Bhubaneswar, but not the end of the world because top 4 teams will qualify. So we've got 12 more questions to go. Well done, everybody. So we're almost halfway through. 2 more questions. Lesion on the foot, identify the organism. Is it pox virus, molluscum contagiosum, HPV1, or HPV16? I'll give you 2 seconds to analyze the histology before I go to the Kahoot app. Identify the organism. Okay, going on to Kahoot. If you've made a diagnosis, you're able to lesion on the foot. Seven or 13 this time. Let's see. And most of you will probably get it correct. 13 again. Right. So indeed, the is HPV1. This is basically a Myrmecia wart. The etiological factor is HPV1. It's not pox virus or molluscum or HPV16. So let's see the leaderboard. I'm expecting it not to be changed much. Oh, yeah, it has changed. So AIMS Delhi is now leading AIMS Delhi 1, followed by AIMS Bhubaneswar, Rishikesh, JIPMA, and AIMS Bhubaneswar 2. Well done. AIMS Dehradun is the highest climber up 3 places, but I don't know where you are. But we still got, we're only less than halfway through, so don't worry. Oops, sorry. Let me just this. Yeah, okay. So the answer is Myrmecia wart, exophytic warty growth with characteristic eosinophilic inclusions. They look quite basophilic on this one, actually, just the picture how it is, but these inclusions are typical of Myrmecia wart. Okay, you don't see these in other entities, molluscum, pox virus, or HPV16. Okay, so this is a more difficult question. This has filtered out a lot of teams. So question 10, 40-year-old female with multiple papules, vesicles, and bullae, a few tense blisters with some flaccid blisters on an erythematous background, few healing with formation. This is the low part of the slide. You can look at it, analyze it, decide whether it's falling, which category it's falling under, which part of the textbook it's falling under. So as a form, Lichenoid, vesiculobullous, paniclitis, vasculitis, whatever you think is appropriate, infective, non-infective. So that's a close-up of the vesicle showing you the level of the blister. Okay. So here you decide on the level. It is a blister. If there's any doubt about it, there is a blister there you can see. So I'm not revealing anything there. So the next thing you need to analyze once you're seeing a blister is the type of cells in there. You decide what the type of cells, which may give you an idea. Look at the base of the blister and look at what's happening in the papillary dermis. Okay. Then I think we go on to some more higher power images. Yes, this is higher power of the cells, type of cells in the blister cavity. Okay. Decide what they are. Then this is slightly lower down in the papillary dermis. Again, you're seeing a number of dots here. This is a blood vessel. Okay. Again, you're supposed to analyze what's happening with the blood vessel. And again, you're supposed to analyze what's happening here and what these probably represent here as well. So there are some clues. Here are some clues as well. Okay. Okay. I think we are done with I think comes the question. What is the diagnosis? A, is it subcorneal pustular dermatosis / pustular psoriasis? B, is it herpes? C, is it leukocytoclastic vasculitis? Or D, is it bullous impetigo? Okay, so you've seen the images. We're not going back anyway. So we'll go on to the Kahoot app so that you can now put in your answers. What is the diagnosis? Expecting quite a few people to be filtered out on this question. Wow, that's actually quite a good number. 15 of you have got it right. And that's well done, actually. I thought this is much more difficult than it appeared to be. The diagnosis is indeed leukocytoclastic vasculitis, bullous leukocytoclastic vasculitis. And I'm glad that quite a few of you got it right. Well done. So let's see what the leaderboard is like. Ames Bhubaneswar is leading, followed by Delhi. NRI Chinnakakan is making a comeback with 3 in a row. But well done, all of you. I thought this was a difficult question, but you've proved me wrong. So why is it bullous vasculitis? This is a vasculitis. You're seeing fibrinoid necrosis, and this is all nuclear dust. Okay. And you're seeing lots of neutrophils. This is the case of Behçet's actually, who are presented with leukocytoclastic vasculitis. So bullous hepatitis subcorneal, and you often you don't see vasculitis. Subcorneal pustular dermatosis, again, no vasculitis. Pemphigus, you may think about, but then there's no acantholysis. Insect bite reaction, yes, no vasculitis again. Herpes can present with vasculitis, but there are no Zank cells, no acantholysis, no acantholytic cells. So herpes is probably the closest differential of all the differentials I've put in. Okay. So this is actually a case of Behçet's, which presented with leukocytoclastic vasculitis with secondary bulla formation. Well done. So brings on to question number 11. What is the diagnosis? So there are about 5 images. You may think that the first image is pretty diagnostic, but then let's move on to the next 4 images. Otherwise, I wouldn't put them on. Second image going on here. This is the first image. Second image. Third image. where you would probably narrow down on your differentials a little bit. Okay. Fourth image, where you probably think, what's happening here? I thought I knew the diagnosis, but something's wrong. And then the fifth image, you think something is really wrong here. I thought there's something else, but what's happening? So we'll again go back. 1, 2, 3, 4, and 5. Okay. What is the diagnosis? Is it lichen sclerosus, amyloidosis, lipoid proteinosis, or porphyria cutaneous tarda? Your option screen, Kahoot screen right now. Only 6 of you have got it right. The rest got confused by the remaining pictures. Your first diagnosis is the diagnosis. I think most of you would have opted for lichen sclerosus if I didn't show you the subsequent pictures. But this is the case of lichen sclerosus with extremely marked basement membrane thickening. And this is the rare case I've seen. In fact, we published this, and if you have read my article on dermatitis on lichenoid dermatitis in the of dermatopathology, this particular image, I think I've published it, showing an example of basement membrane thickening in lichen sclerosus, which can be pretty awesome. So you can see how thick the basement membrane is. So basement membrane thickening, lichenoid interface change, all can be seen in lichen sclerosus. That's one more example of where you can see basement membrane thickening, along with dermatomyositis and DLE. Okay, so these are NTs where you see basement membrane thickening. So this may have filtered out a lot of people here. So yes, we have AIIMS Bhubaneswar again leading, followed by Bhubaneswar 2, Jodhpur, and AIIMS Delhi. So top 4 teams qualified. We've got 9 more questions to go. So the rest of you, I don't know how far behind you are you, but you still have a lot of time. So please, don't get disheartened. So question number 12, which are the likely to be the diagnosis? Which of the following is unlikely to be the diagnosis? So this is the first image. Second image, which is unlikely to be the diagnosis. Second image. Okay. Third image. I think this may be it, or there may be one more. Yes, there is a fourth image. There you go. Okay. So you've already made a diagnosis, hopefully, which is unlikely. Fixed Reals melanosis, melasma, or ashy dermatitis come now. I think we better not give you too much time because all of you seem to be experts in dermatopathology. If I give you too much time, you seem to be answering a little bit. Excellent. 13 of you have got it right as usual. 13 good teams in here. So the answer is, this is basically a lichenoid infiltrate with a lot of pigment incontinence. And yes, FDE, Reals melanosis, and ashy dermatosis all share a similar histological picture. Melasma is non-inflammatory. So let's see what it's like. AIIMS Rishikesh now is on top, followed by Bhubaneswar 2. Bhubaneswar 1 seems Jodhpur has the highest answer streak of 10. Wow, well done. So then followed by AIIMS Delhi, Jipmer team 3. Well done, AIIMS Jodhpur. That's pretty good. Awesome. Answer streak of 10 is really good. So question number 13 to follow now. Which special stain will be positive in this entity? This is a low power. We'll be showing you higher power images. Which special stain will be positive? This is slightly higher power. So you have to make a diagnosis even on this power actually. And this is going higher power, and this is going even higher. If you've not made a diagnosis by now, I don't think you will. So let's go on to the question. Is it Congo red, Tolden blue, or colloid lion? And your options start now. Which special stain will be positive in this entity? 5 of you have got it right. A lot of you have opted for Toledan blue because you saw the blue color. That's the red herring there, unfortunately. What do we use Toledan blue for? Anybody who knows? What is the Toledan blue stain used for?
Mast cells.
Mast cells, excellent. Yes. Why are we using colloidal iron here?
Collagen stain.
Nope, not for collagen.
Mucin.
Acid mucin.
Mucin, yes, indeed. And why are we looking for mucin here? What's the diagnosis? Anybody? What's the diagnosis?
Mucinosis.
Nope, not mucinosis.
Sleeve mix. Necrobiasis typhoid.
Nope, not that.
Pseudoxanthoma
Nope, not that.
GA.
Yes, it is GA. Granuloma, you're seeing the clear, collagen degeneration, and you see the palisading granuloma. Okay, so if you identify the giant cells, we'll go to the question in a second, but let's see who's on. So most of you have popped in the right answer, or 5 of you have popped in the right answer without knowing what the entity is. So AIIMS Rishikesh, AIIMS Jodhpur, then followed by BBSR. AIIMS Jodhpur is an answer streak of 11. That's simply wow. Well done. AIIMS Delhi and JIPMA team 3. So, so let's see. So this basically is a low power view, a busy dermis appearance of granuloma annulari, typical palisading appearance, lymphocytes and histiocytes palisading around, degenerate collagen bundles. You can see mucin separating the collagen. Degenerate on this entity, but you're not staining the collagen actually with mucin stains. We're actually staining the mucin if you want. This sort of bluish streaks in the background view stain is mucin. That's what's separating the collagen bundles. So that's a giant cell there, and that's a degenerate collagen bundles palisading. The histiocytes are palisading around the degenerate collagen bundle. Okay, so there is colloidal iron for mucin. If I had put an Alcian blue, probably would have been easier. You would have known it's mucin, but I wantonly put in colloidal iron because it's not commonly used for mucin, but you should know it. All right. Now, question number 4, 6 more to go. These 2 related diseases demonstrate a common histological feature. What is it? So the 2 diseases are related, and they're related by this common histological feature. What is the histological feature? This is very easy. I'm not going to dwell much on this. So look at the question, look at the images very quickly. That's image number 1. First disease. Oops, sorry. Yes, image number 2, second disease. Both are related. And then that's the histology. Okay, both are related by this histology. And what is the histological feature that they're related by? Is it chronic leukocytoclastic vasculitis? Is it a mixed granuloma? Is it a plasma cell-rich infiltrate, or is it eosinophil-rich infiltrate? Okay, so your options are going to get displayed on Kahoot right now. I've given you quite a few clues, so if only 5 of you have got the answer correct. So whoever's got the answer correct, what are the 2 different diagnoses we are looking at?
Granuloma faciale and EED.
Excellent. It is granuloma faciale and EED, and both have chronic leukocytoclastic vasculitis as a common feature. Well done. So both have a neutrophil-rich infiltrate, not a plasma cell or eosinophil-rich infiltrate. And the picture I showed you, the histological picture, is actually a clue. I don't know why you didn't get it. That's typically showing a nice vasculitis. You can't go wrong there. If you had looked at the histological picture, irrespective of what the question was, you could have made a diagnosis of chronic leukocytoclastic vasculitis. So you need to be able to pick out the different clues here. Okay. So let's see what the leaderboard is like. AIIMS Jodhpur is now leading with the highest answer streak of 12. That's awesome. Then AIIMS Bhubaneswar 2, AIIMS Rishikesh, AIIMS Delhi 1, and NRI Chinakakani. Okay, very close, very close. So top 4 teams are very close, followed by NRH Chinakakani, which is only 500 points behind. So we've got 6 more questions, I think. So that's there's still a chance for the rest of you. Okay. Question number 15 is slightly more tricky, I guess. 56-year-old male with lesions on the ankles. Which condition or drug is not an etiological factor? Okay. Clinical history is very important. All my questions, clinical history is very important. So that's the histology. That's first image. Okay. I'll give you a few seconds to digest the image, analyze it. And this is the second image. Okay. So if you know the answer, you probably know it already. Otherwise, you will, but actually, I've given you a clinical picture as well, I think, to make this easy for you. There you go. So that's a clinical image, which is not an etiological factor. Is it venous stasis, warfarin, rheumatoid arthritis, or hyperhomocysteemia? So we'll go on to Kahoot because I don't want to give you time to Google. Which condition or drug is not an etiological factor? Oh, this would be very easy. It is indeed not so easy, right? So 3 people who've answer. What is the diagnosis here? Or anybody else?
Livedo vasculopathy, sir.
Yes, it is livedoid vasculopathy. And why is warfarin the right answer? Because you're looking for warfarin is one of the you use anticoagulants as a treatment for livedoid vasculopathy, don't you? Because it's a procoagulopathy. It's a hypercoagulable condition. So usually associated with hyperhomocysteemia, which is a procoagulant condition. Autoimmune diseases like rheumatoid arthritis, venous stasis, these are etiological factors for it. And warfarin is not an etiological factor. In fact, you may use it for treatment if you want to. Not a common thing that we use. We normally use aspirin or pentoxifilin, etc. But warfarin is not the cause for it. Okay. So the answer is indeed rheumatoid arthritis is associated with autoimmune conditions like rheumatoid arthritis, SLE, etc., antiphospholipid syndrome. These are associated with livedo vasculopathy. You may have got the diagnosis right, but if you're not good in your theory, you get the answer wrong. So I'm not only looking at pure histology, this is dermatopathology. So I want a bit of your dermatology knowledge as well. Everything is important. Even for pathologists, if you're attempting to go onto the American board or the European board, these are the questions you'll be asked. You'll be asked on your dermatology knowledge as well. You need to know some amount of pathophysiology. If you're not good in pathophysiology, this is not pure clinical dermatology. This is pathophysiology, and this is part of your dermatopathology learning. So that's why I put in this question. So let's see what the leaderboard is like. AIIMS Jodhpur is still on top, then followed by AIIMS Bhubaneswar, Rishikesh, Delhi, and Team 3 Jitmar. AFMC is the highest climber. So the leaderboard hasn't changed despite only 3 of you getting the right answer. Interesting. Okay. So we've got questions 16, 17, 18, 19, and 20. 5 more questions to go. Yeah, atrophy blanche. I think we all know that. I've already discussed. Question number 16. What is this histological feature called? So that's your image. There's only one image to go by. What is this histological feature called? Okay. So you either know this or you don't know this. And your options are Pityriaciform spongiosis, Pautrier's microabscess, pagetoid spread, or Monroe's microabscesses. What is this histological feature called? And your options are being displayed now. Excellent. 10 of you have got it right. It's not pitras. These are typical Pautrier's microabscess. These are all lymphocytes, abnormal lymphocytes going up into the epidermis. This is not pitras from spongiosis, but because there's no real spongiosis in this. These are just so the diagnostic feature in MF or cutaneous T-cell lymphoma is the presence of epidermotopic lymphocytes in the absence of spongiosis. So there's not much spongiosis there, in fact. Pagetoid spread is probably a reasonable differential, but then pagetoid by definition implies single cells. They're not in groups. They can sometimes go in groups, but when you say pagetoid, you mean single cells ascending. Manvos microabscesses are usually neutrophils, and it's seen in the setting of psoriasis. I didn't show it of psoriasis, so that's not what it is. So let's see what the leaderboard is like. So NRI Chinnakakani has come up. AIIMS Delhi has gone down by a place. So it's a very close fight. It'll be very unfortunate if one of you misses out. Top four seem to be pretty standard now. 4 more questions to go. I don't know how far behind the remaining teams are, but please try and pick up. AIIMS Jodhpur has done really well, followed by Bhubaneswar, Rishikesh, and Chinnakakani. Okay. Next, going on to question number 17. This is a bit tricky. A 3-year-old child presents with a generalized skin disease present since birth. Which of the following is true? Okay. 3-year-old child, history is very important. All the questions. Generalized skin disease. Which of the following is true? That's a histology. It's a typical spotter, actually. Know it or you don't know it. And if you know it, we'll move on to the next part of the question. So which of the following is true? It is caused by missense mutations in keratin 1 and keratin 10. It is not associated with palmoplantar keratoderma. Hair abnormalities are frequently seen, and nail abnormalities are frequently seen. There's only one correct answer. And I'm moving on to Kahoot right now, because I don't want you Googling. Generalized skin disease since birth. If you know the histology, then you know the answer. Excellent. This is indeed caused by missense mutation in keratin 1 and keratin 10. This is epidermolytic hyperkeratosis. Even if you didn't know the remaining ones, you know that this is true if you know what epidermolytic hyperkeratosis is. You may not remember the nitty-gritties. Hair and nail abnormalities are not usually seen, and it is associated with palmoplantar keratoderma. So even if you don't know the remaining, you know that is caused by missense mutation in keratin 1 and 10 if you know what epidermolytic hyperkeratosis is. It's basically in childhood, it manifests as bullous ichthyosiform erythroderma. That's why the patient has a generalized skin rash since birth. Indeed, epidermolytic hyperkeratosis can be seen incidentally in a number of other entities, but this I'm clearly telling you is a congenital, inherited condition by the history. So AIIMS Jodhpur is still on top. AIIMS Delhi has come up, followed by AIIMS Bhubaneswar. So pretty close, only a 300 4th and 5th position. Okay, let's see how this goes. So we've got 3 more questions to go. Very close indeed. So yes, epidermolytic hyperkeratosis. It may be seen incidentally in an epidermolytic acanthoma or in palmoplantar keratoderma or epidermal nevus, or incidentally in various tumors, etc. But in this case, the history is the clinching factor. This is bullous ichthyosiform erythroderma. Question 18. What is the name given to the sign demonstrated here? Given to the sign demonstrated here. I'm showing you a sign here. Okay. Again, you either know this or you don't. Your options are checkerboard pattern, salute sign, last week sign, or sandwich sign. Okay. So we'll go on to Kahoot because the leaderboard is very close. I don't want to give too much time. Right. Only 4 of you have got the correct answer. It looks like a salute, doesn't it? And therefore you've gone for salute sign. Okay. Anybody wants to tell me what salute sign is seen in? Whoever has answered salute?
KB's
Last week's
sign.
No, the answer is last week's sign. What was salute sign seen in?
PRP.
Not PRP. PRP, you see a checkerboard
That is
pattern.
rosy. That is rosy.
If it's rosier, you see the salute sign. Okay. Salute sign is usually you see a amount of parakeratosis actually, which looks like that. Odd sign. And that's pityriasis rosea, usually around the hair follicle. Where you see it around the infundibulum. Okay. That's what is pot sign or salute sign. This is last week's sign, and I'll tell you why. It's not sandwich sign either. I'll explain in a second. I thought a few of you would be put in the checkerboard pattern, but you haven't. Okay. So let's see. Only 4 of you have got it right. Let's see how the leaderboard is like. Right. So AIIMS Delhi is now moved up, followed by AIIMS Bhubaneswar, Rishikesh, and Jipmar. So unless you do really badly, you're probably going to the finals with just 2 more questions to go. Let's vote the answers subsequently. Jipmar Team 3, you're very close. Only about 800 points difference. So let's see. Okay. So this is last week's sign. Why is it last week's sign? Because there's a row of parakeratosis here, and then you've got orthokeratosis. Orthokeratosis means normal. Week sign is basically where the pathology has happened last week and the skin has recovered. And the normal skin basically has got orthokeratosis. The previously pathological skin has produced keratin, which is just a layer on top, and that's being shed away. Okay. So that's what is last week's sign. That's different from the checkerboard pattern. That's different from the so you can sandwich sign again different. You're seeing you often see orthokeratosis on top and then parakeratosis underneath, and between them there is there are these hyphae basically. Okay. So question number 19. Which of the following is true about this entity? Now, this is a deciding question, and I've specifically put this up at the end. The last question is probably easy. 19 questions is toughest. Which of the following is true? Now, you have multiple options here. You can choose 1, 2, 3, or 4. The number of points you receive is dependent on number of correct answers you choose. So there are 4 options. All 4 may be true, 3 may be true, 2 may be true, or 1 may be true. So depending on what you choose, that's how your marking will be. And it's also, this is your histological picture. So this is a low power of this particular entity. I think the diagnosis should be pretty obvious to you, even on this low power, if you know basic histopathology. But then this should clinch the diagnosis. This is a higher power of the same thing. So low power here, and probably a higher power of somewhere along there is this slide. Okay. So if you now made your diagnosis, choose all the correct answers that you think are true. Microangiopathy is one of the etiological factors for the acquired form of the disease. Microangiopathy is not a factor in the inherited form of the disease. Hypothyroidism is a known association. Lesions develop in diabetes only if there is coexisting renal disease. And your option will start now. Multi-select, choose all the right answers, and double points as well. So this will, you get double the points if you get all the correct answers. 30 seconds as well to answer this. So only there's one wrong answer, which is number 4. Lesions develop in diabetes only if there is coexisting renal diseases wrong. Diabetic. So this is basically perforating collagenesis. Okay. I showed you nice, neat perforating collagen fibers, typical crateriform low power appearance with an ulcer there on top, with necrotic material in the center and collagen bundles nicely perforating through. I think there's no doubt as to whether you know your histology or not, well, about the histological diagnosis, but then the differentiating factor here is how good is your theory. So the etiological factor usually, whether it's diabetes or renal disease in the acquired form, is usually microangiopathy. Okay, so the acquired form microangiopathy is that, and everybody have got, all of you have got it right. Microangiopathy is not an etiological factor in the inherited form usually because it is usually an inherited defect in the collagen. So microangiopathy in the acquired form usually causes a defect in collagen, and collagen defect is the main reason why the collagen fibers are excluded out. The collagen basically is degenerate, and these degenerate collagen fibers are pushed out through the dermis, to the epidermis. Okay, so in the inherited form, there's a defect in collagen or elastin, say in elastosis perfringens, elastosis perfringens serpiginosa. Hypothyroidism is a known association, and that is also true. So basically, a lot of you have got the second option wrong. Lesions develop in diabetes irrespective of. See what the leaderboard is like. It's double points. So AIIMS Bhubaneswar have managed to go on to the top, followed by AIIMS Jodhpur, AIIMS Delhi 1, and AIIMS Rishikesh, followed by NRI Chinakakani. So AIIMS Delhi, it's a very close fight between Rishikesh, Delhi, and Chinakakani because you've got only one more question to go. Right, let's see. I don't know how the remaining are, but it seems to be a very close fight. Okay, so the last question, you have to get fastest fingers first. I'll probably be very quick with showing you the question as well. Based on the histological findings and likely diagnosis, guess the probable site of biopsy. So if you know your basic histopathology, you'll be able to guess the site of biopsy. That's a histology. Okay, so guess the site of biopsy. Is it the knee, palm, scalp, or lip? Let's move on to Kahoot. Knee, palm, scalp, or lip. What is the correct site? Likely site. Right, it's an easy question. All of you have got it right. So it all depends on who's fastest fingers first. So well done, all of you. We show you the leaderboard. I think the leaderboard probably wouldn't change very much. And let's go on to the leaderboard and see what it's like. Well done, all of you, for participating. And I hope the audience also enjoyed the questions. I'll obviously have to make the questions much more tougher because looks like we have a very close fight. AIIMS Delhi at number 3, Delhi 1. Number 2 is AIIMS Jodhpur, you've dropped down a point. And number 1 is AIIMS Bhubaneswar 2, well done. Now, number 4 should be showing in a second. AIIMS Rishikesh, and number 5 is NRI Chinakakani. Well done, all of you. You've done excellently well. I'm not sure how the remaining are, but I'll post the results of the remaining as well in the group. And that's excellent. Let's see the summary. Maybe I'll be able to see it there. See. By the way, since you're anyway here, you can post your feedback in the app, how the questions are, and if you want me to improve them or make them tougher or easier for the mains quiz. So please do that. And if you have any comments, please feel free to post them. Anybody in the teams wants to speak up? Congratulations to all the winners. You've done really well. AIIMS Bhubaneswar, you've come well, and AIIMS Jodhpur, excellent streaks, 14 out of 20. AIIMS Delhi, 13 out of 20. So that's very good as well. If I can see the full report to see who scored how much out of how many. Just a second. Right. So, right. Looks like the top 6 have scored really well. Correct answers, you've got so NRI Chinnakakani, you've actually scored really well. You probably only lost out on how quickly you answered because you got 65% correct. So NRI Ames Rishikesh and Chinnakakani are very close. That's a very close fight. Followed by JIPMER Team 3, Sai Sudha, Ames Bhubaneswar, Ames Delhi, and JIPMER 2. I probably won't go down the list any further, but well done, all of you. Dr. Pratisha, any comments? Anything to say?
Yes, sir, it was very engaging quiz.
So everybody, nobody disqualified from the quiz. Everybody was being good.
Yeah, no one were, all were good, sir.
Excellent. Well done, all of you. That's welcome to Visakhapatnam. If any of the top teams are not able to make it to Visakhapatnam, please let me know, which means that the next team in the list will be able to take their place.
Yeah, NRI Chinnakakani will get the chance.
Yeah, Nagai Chinnakakani will get the chance. Given that, I don't know, only 4 teams are allowed. Otherwise, I would have allowed Nagai Chinnakakani to come as well to participate because they are very close. I feel a bit bad to let them out just on the basis of time because number of questions wise, they're the same. We'll see. We may make an adjustment. I'm not sure yet. We'll discuss with the our committee and then decide whether you may be able to join in. But 5 teams would be a bit tricky to put you in the main hall. So for now, I'll have to just say it's 4 teams. And yeah, welcome. Forward to seeing you all. Okay. Anything to say from Glodoma team?
Yes, sir. Thank you so much, sir, for giving me opportunity, and we look forward to another opportunity with us. Thank you, all of you. Thank you, sir.
Excellent. Thank you all. Bye-bye.